Hello and welcome to the Coalition for Life Course Immunisation and International Longevity Centre UK webinar, Vaccines and Vacation, the role played by immunisation in getting tourism moving again. My name is Patrick Swain and I'm the coordinator of the CLCI-ILC Alliance, and I will be chairing today's webinar. Thank you to everyone who is joining us today, and we're delighted to have you with us. And we're also joined by an expert panel of speakers. Just a quick overview of CLCI and ILC for those who haven't joined one of our webinars before. So CLCI is a network of European individuals and associations representing public health, patients, academies and health professionals committed to preventing infectious disease over the life course by highlighting the benefits of immunisation to our peers and to policymakers. And ILC is the UK's leading specialist think tank on the impact of longevity on society and what happens next. It is also one of the founding members of the ILC Global Alliance, which is an international network on longevity spanning across 16 countries. So today we're going to be talking about the role immunisation can play in benefiting the tourism industry. And we know that COVID-19 has demonstrated the threat posed by infectious diseases. Recent estimates in the past week have suggested that up to 50 million people may have died from COVID-19 and that 4 trillion could be lost worldwide due to the pandemic's impact on tourism. Yet immunisation has played an important role in curbing the pandemic. COVID-19 vaccines have saved hundreds of thousands of lives of Europeans and helped aid the continent's economic recovery. It is not just COVID-19 vaccines. Other routine vaccinations play an important role in protecting our health and keeping us socially and economically active. So today we'll be hearing from both CLCI and ILC on how vaccines can help the tourism industry, followed by 3 panelists who will be offering their scientific, policy and economic perspectives. We will then want to hear your views in the Q&A. But before we get started, I just want to run through some housekeeping rules. So internet issues may affect sound and video, so do bear with us if this occurs. At the bottom of your screen, you will see the chat function to communicate with panelists and delegates, as well as the Q&A feature where we'll be collecting questions for the panelists. So do put your questions in down there. In the interest of time, we would appreciate if you keep your questions short relating to the topic for today's webinar. And if you're having any issues with your video or audio throughout the webinar, try to connect with the Ethernet cable or tether from your phone. And if you get disconnected from the webinar, do use the same link from the Zoom confirmation to jump back in. And do get involved on Twitter as well, using hashtag vaccines and vacation and tagging ILC UK and CLCI on the handles below. And as always, this webinar will be recorded and published for public access on our website and our YouTube channel. And the presentation slides and the recording will be published on our website too. And as I say, do submit any questions you may have in the Q&A feature below. We'll be asking panelists at the end of presentations any questions you may have. So without further ado, I'd like to crack on with proceedings and introduce our first panelist, who is the CLCI chair, Dr. Daphne Hall. So Daphne joined the world of charity management in 1999 after 30 years of medical research and education, first with the UK Medical Research Council and then at Imperial College in London. She helped found the Coalition for Life Course Immunisation and became its chair. Daphne is a member of the editorial board of Vaccines Today and is generally active in the world of vaccine advocacy. Daphne, it's great to have you on board today to show CLCI's findings and ideas, and the floor is yours.
Thank you for your introduction, Patrick. The summer vacation season will soon be upon us, hopefully, and never before has the travel and tourism industry suffered as it has done during the years of the COVID-19 pandemic. Last week, I finally plucked up courage and took my first trip on a plane for almost 2.5 years. And I admit that I was apprehensive, despite being fully vaccinated. And my thoughts ran along the lines, would my fellow travellers and would the staff be as well vaccinated as I am? And would they still wear their masks or use their hand sanitizers? Actually, I need not have worried, but it appeared that I was not the only one who had doubts about travelling. The airports and train stations that I used were much, much quieter than they were 2.5 years ago. So as we move into the summer season, we need to look at how vaccines and vaccination can help in getting travel and tourism moving again. And my presentation is not detailed, but I guess it will set the scene for the other speakers today. So next slide, please. Consumers are aging. Now, almost a quarter of EU tourism is geared towards older adults, or is taken up by older adults. And Patrick has already said that $4 trillion has been lost. Vaccination is a key way to prevent severe infectious diseases. We all think about travel vaccines, for example, but others are also important. They help to keep the economy moving. Next slide, please. Vaccinating older consumers is economically important, but it's also key to remember the workforce. Staff working in the industry also need to be protected so that there is an active workforce able to meet the demands of what we hope will be a post-COVID increase in travel. And I think I've missed a slide. So can we go back a slide, please? That's better. Sophia will say a lot more about the economics than I've said. I'm sorry, I missed that bit. Okay, slide 3 again, please. We hope that there will be a demand in and an increase in post-COVID travel. And as an example of the potential difficulties, it was reported on Sunday that European airline EasyJet would remove some of the seats from its smaller aircraft so that they could be operated with less crew members, as many of the staff were off work having caught COVID-19. And I also noted a snippet this morning, which I believe the Heathrow Airport in London were also indicating that although they've had a busy time very recently, that they were expecting that they would only have 65% of their normal travel, or as compared to 2019. So there is still a big gap in the tourism. Next slide, please. COVID-19 has indeed shown us the power of vaccination. And I'm sure that both Mark and Isabel will have much more to say about this and other vaccines. On the whole, Europeans of all ages and stages of life have responded well to the COVID-19 vaccination programme. After a slow start, the vaccination programme surged forward. And in just the 2-month snapshot that you can see there between May and August 2019, there was a steep rise in the percentage of adults who received 2 doses. And at the end of that year, 2019, the percentage stood at around 80%. For an example, Portugal, by that time, had reached 92% of adults that were fully vaccinated. However, I do have to say that these cumulative figures mask the stark differences between the countries in the east and the west of Europe. Nonetheless, as Patrick has said, the lives of many people have been saved. Next slide, please. It's, however, a different story for other vaccines. The uptake of vaccination against influenza, for example, remains below the WHO target of 75%, which was set now over 12 years ago, and still very few countries have actually reached that number. Next slide, please. Pneumococcal vaccine coverage is even lower, with the coverage in older Europeans hardly reaching 30%. But as always, we need more data. Next slide, please. But the real issue on which all else depends is that spending on immunisation as a percentage of total health budget is suboptimal in the majority of European countries. Before the pandemic, 77% of EU countries spent less than 0.5% of their health budget on immunisation. And that is scary, and we have to change that. Next slide, please. So what needs to be done? Beyond COVID-19, vaccination programs need to be properly funded to ensure that older adults, and indeed people of all ages and stages of life, receive the vaccines that they need. We must make sure that access to vaccination is facilitated by providing opportunities in a number of local settings, and providing vaccination in the workplace should be considered so that we can help create a proactive and productive tourism sector. And add to that, I'd like to add to that the point that when we speak about a proactive sector, we should raise the issue of sustainable tourism. It will be critical in the future that the elements we bring together here today, that's health and economics, are joined by issues around pollution and the environment. And I guess that Grazia will give us some hope for the future in that respect. Thank you.
Thank you very much, Daphne, for that very insightful presentation. There's clearly a lot more that can be done to support and finance immunisation more. I think you make a good point there about the workforce as well, in order to keep the economy moving. Okay, so I'm now pleased to introduce our second presentation from ILC, and Sophia Demetriardis, who is ILC's senior economist, will be presenting this one. So Sophia joined the ILC just over 3 years ago in May 2019 as a research fellow. Her work mainly focuses on understanding the longevity economy, both in the UK and internationally, as well as exploring ways to boost individuals' retirement prospects in the UK. Prior to this, she worked as a policy and research officer for Ash Wales, working to inform and influence the tobacco control policy agenda in Wales. Before working at Ash, Sophia worked as a social researcher for the Office of National Statistics, where she worked on publishing statistics releases on key health measures. Sophia has a Bachelor of Science in Politics, Philosophy and Economics from the University of Warwick, and a Master's in Economics from the University of Nottingham. Sophia, thank you very much. Over to you.
Thank you, Patrick, and thank you, everyone. It's really great to be here today and discuss such an interesting, two different agendas, which I think should be considered more closely. There was a really interesting point, Daphne, about vaccination spending pre-COVID. I think that really highlights, the issues we have today. So I'll be kind of following on from these points, really focusing on tourism and the longevity dividend, really thinking about spending, so how health and vaccination, investing in vaccinations, support spending in the tourism sector. Next slide, please. So the key kind of point of today's presentation is essentially that as our populations age, there's a huge economic opportunity in growing spending among older adults and in the tourism sector, but health is essential for realising that growth in spending. So just some key stats in the UK first. Our research shows that older household expenditure is rising fast, mainly because there's going to be more older households going forward as our population ages, but also each older consumer is spending more over time, and that could be due to a number of factors, for instance, growing income because people are working for longer. We've seen decreases in pensioner poverty, and also decreases in kind of health barriers, which we'll talk about soon. So what we're seeing in a combination of all these factors is that by 2040, over 50s will spend around 63p in every pound. Now, of course, caveating this is pre-COVID trends. That has obviously changed things up, but that was kind of the trends that we were seeing, huge growth in spending. And this is particularly driven by rising spending by households aged 65 and over, which grew by 75% from 2001 to 2018. And for this age group, we're seeing a particularly large increase in households headed by someone aged 65 and over, so population growth, but also an extremely significant growth in income as well. That could be supported by decreases in pensioner poverty, at least until recently. So for instance, many people having kind of defined benefit pension schemes, which are relatively generous, that may be supporting that growth in spending. And again, we've seen that growing spending power and income, and we see that in the UK, the share of total disposable income that belongs to older households is projected to rise to almost 60% by 2040. So that is supporting that rise in spending. Next slide, please. So we're seeing those trends in the UK, but that is not unique there. We're seeing that across the world, really. So our research, the Global Longevity Dividend, which we published a few years ago, showed that across the G20, older households' market share, which rose from 54% to 56% from 2010 to 2015. So essentially, older households are responsible for over 50% of consumer spending across the G20. And we're seeing that growth in most G20 economies. And just to put this in context, spending by older households in the G20 in 2015 averaged about 22% of GDP, and that's more than the combined GDP of Japan, Australia, Canada, and Brazil. There's a huge market opportunity there. Next slide, please. But going back to kind of the point about leisure and travel, we're seeing a particular strong growth in these sectors. So what we're seeing, and I'll talk about this in a second, is that traditionally spending at older ages, spending tends to fall at the oldest ages. And so what we were seeing is that people were saving a greater share of income and only spending mostly on kind of essential goods and services, but that is all changing. So we're seeing that growth in spending primarily on sectors related to non-essential purchases such as leisure. So in the UK, the top 3 growing sectors for older consumers are recreation and culture, followed by transport, and followed by household goods and services. So this is outside of kind of household bills, so paying for your mortgage or rent and utility bills. These are the fastest growing sectors. And also internationally, we're seeing that the top 4 fastest growing sectors serving older consumers in the US, Australia, and Canada include recreation and culture or transport, so across these economies. I'm sure that's the case in most economies as well. So huge growth in these sectors. Next slide, please. But there is a big but. There is an opportunity to increase older household spending, older adult spending further. And the reason is poor health is a key barrier to this spending. So if you could look on the graph on the right, what we're seeing, for instance, in 2004, spending by the average older household fell significantly after people at consumers age 50 to 64. There was a huge drop in spending. Now that's been changing. So, really highlighting the point, it's not just that older adults are spending more. There's more older adults in the economy or more older consumers. They're also each on average spending more because of those trends I talked about. But we're still seeing a significant drop in spending by people aged over 74. And that's expected to continue to be the case by 2040, looking at our projections. Now, interestingly, this is not just driven by a drop in income. So we do know income falls at older ages. We see that people older ages are actually saving a greater share of their income. So essentially, they have the means to spend more, but they're not. And so there's likely to be some barriers there. And just to put this in perspective, we found that 80-year-olds save an average of nearly £6,000 a year. And we do know that at the oldest ages, many people spend the majority of their free time watching TV alone, which we know is probably not very good for health. We know it's important to keep stimulated and engaged. So there's, a real win-win opportunity to change this. And so, as mentioned, we think there's avoidable barriers are playing a part in that drop in spending and increase in saving. And our research, previous research has found that in the UK, poor health is associated with lower spending rates at older ages. And this is controlling for income. So income is not explaining that. And what we found is that tackling the barriers to spending by people aged 75 and over by 2025 could add about 2% to GDP a year in terms of the consumption factor in GDP by 2040. So there's a huge benefit to our economy and to particularly thinking about consumption if we tackle these barriers to spending. Next slide, please. So kind of picking up on that point about the importance of health, our research global longevity dividend found that across 27 European countries, older people in better health, so for instance, those who had better condition or less limited daily activities or who report being in good health are more likely to spend more as well as work and also volunteer more. So that was kind of at the individual level, but also across countries at the country level, we're seeing that spending rates as well as employment rates at older ages are higher in countries that spend more on health and prevention as a share of GDP, have higher flu vaccination rates. So we're seeing that vaccination is a really important part of prevention and have healthier older populations. Next slide, please. No, next slide, please. Oh, sorry, slide back. Sorry, I missed that. So just to kind of put that in perspective, a 1 percentage point increase in flu vaccination rates across countries is associated with a 0.6% increase in average yearly spending. That would have amounted to about $12 billion to US consumption in 2015. Looking at preventative health spending, just a 0.1% increase in preventive health spending is associated with a 9% increase in annual spending. And that would have added about $180 billion to the US economy in 2015. So there's real returns to investing in prevention and including vaccination. And McKinsey, really, a report that they published recently really highlights that this is an investment when you invest in prevention. So they showed that they estimated return about $2 to $4 for each dollar invested in improving global health, mainly via known preventative interventions. And I think it's really important to highlight that there's two key opportunities here that we have. So firstly, we have those spending projections that we saw, that older adults are expected to spend more as our economies age. But they're not set in stone. They might falter. And we've seen that with COVID. We've seen that those trends in older adult spending is just completely been thrown out of the water. And essentially, if we're not investing in prevention and vaccination and all the things to ensure older adults are able to kind of remain active in the economy, we will not see that going forward. And we might see a drop in consumer spending as a share of GDP. And that will significantly affect businesses. So it's a real kind of concern. But secondly, we've got those new market opportunities. So the fact that, people aged 75 and over are still expected to not be spending, as much as their income as they could be doing. And there might be barriers. We know for sure there's likely to be barriers playing a part in that. So there's this new opportunity to realize that if we can tackle those health barriers. Next slide, please. And just kind of picking up on those points again, if we're just focusing on kind of flu vaccination, our previous research, highlighted there's a huge health case for investing in flu, but also an economic case. So, the best case scenario, flu vaccination can prevent 28.9 million sick days annually. So that's money which could be spent traveling, consuming, and working. We talked about, what Daphne was saying, ensuring that the tourism sector has that thriving workforce is vital. But also, the demand for that sector is predicated on people not taking these sick days and that increasing as our population ages. Next slide, please. And just kind of specifically focusing on the tourism sector, pre-COVID, I think Daphne pointed out, nearly a quarter of EU tourism nights was spent by those aged 65 and over. But interestingly, nearly half of Europeans who did not make tourism trips, those aged 65 and over, mentioned health as a barrier to doing so. So this is really important. And actually, there's a reinforcing cycle here. We do know that increased spending on tourism at older ages is actually related to better physical health and mental health. So, prevents a decline in kind of cognitive, it slows down kind of cognitive aging. So it's really important, there's a feedback. If we can invest in health, invest in vaccination, people can go out and about. And again, that's better for their health. So that's a positive circle, reinforcing circle. Next slide, please. So finally, just final slide here. Why do we need to invest in prevention? As we've seen, being healthy in later life is key for the European tourism market. Older adults make up a large share of travellers and are active consumers, but investing in health and prevention is vital to unlocking that further. Immunisation is a key component of healthy ageing. We've seen that vaccination, the vaccination against flu, pneumonia and shingles are really important and just important as COVID-19, and we shouldn't forget that. And finally, ensuring older adults get vaccinated against all preventable diseases is vital to ensuring greater economic activity. We've got these huge economic opportunities ahead of us that are not set in stone, and we need to be making those investments to realise them. Thank you.
Thank you very much, Sophia. So it's very clear to see that there's a lot more to be said about investing in vaccination in order to help the economy, but also tourism. That's really good to hear. So now I want to move on to our panelist presentations. So today we're joined by 3 experts across different industries who will be sharing their insights. First up, we have Professor Mark Doxie, who is a senior manager in global medical affairs at GSK. So if we can move to the next slide, please. So New Zealander Mark Doxie graduated from Auckland Medical School in 1989, and since then has worked on basic immunology and vaccine development in the US, Europe, Africa, Asia, and Latin America. This has included, among other things, time as a faculty fellow at the National Institute of Health in, I'm going to butcher this word, Waseda, WHO Distinguished Visiting Professor at the Instituto Biomedicas in Sao Paulo, adjunct professor at St. John's Medical College in Bangalore and Auckland Hospital in Bergen, and coordinator for the research and strategy at the Statens Serum Institute in Copenhagen. Currently, he works as a senior manager at GSK Vaccines, with a focus on immune function and vaccination in older adults, as well as externally with colleagues at Auckland Hospital and WHO, focusing on respiratory infections and TB. Mark, you have a lot of experience, so without further ado, I will pass over to you.
All right, thank you. Could we have the next slide, please? In fact, we can probably jump through two because the first one is just an intro slide. So I couldn't really ask for a better introduction. It's been made plain that older adults are a growing portion of the consumer market generally, and maybe particularly the travel market. And when you look at property trends, when you look at population trends, that spending is only going to increase. Can we move to the next slide, please? But there are some other consequences of vaccination and the relatively poor rate of vaccination that we have in older adults, which actually make this connection even more important than the previous talks did. And what we're seeing with older adults, it's already been mentioned that a lot of discretionary spending, including things like travel, is dependent on having good health. People who are in poor health don't go out, they're homebound, their spending in other sectors of the economy decreases, and inevitably, as people age, you can see there's an increase in non-communicable and, in theory, non-vaccine preventable disease. And it's been estimated that 1 in 5 people globally have an underlying risk condition. This was for COVID, but it applies to a lot of infectious diseases. Can we have the next slide, please? And you can see the kinds of comorbidities that we're talking about here. Again, figures here from COVID, but this applies to a large number of infectious disease. So people with cardiovascular conditions, people with diabetes, chronic kidney disease, chronic lung disease, these are all factors which we associate with increasing age, particularly in the over 50s. They're all conditions which put you at risk of infectious disease, or at least of some infectious diseases. Next slide, please. And this is just an example. I showed you the COVID data. This is what the numbers look like from the US. People who have a comorbidity make up a significantly higher proportion of those who are hospitalized than the population, the age equivalent population as a whole. And it's a broad range of illnesses. You've seen the ones mentioned here. So let's move on to the next slide. So I said before, these are conditions which are theoretically unconnected with vaccination and infectious disease, but actually that's not really the case. If we have a look at myocardial infarction or stroke, what we find is that people who have had the flu, this is British data, in the period immediately after they've had the flu, their risk of suffering a heart attack or a stroke is increased between 300 to 500%. It's a big increase. And that risk persists out. In this study, the risk persisted out to 3 months. A recent Danish study suggests that actually that risk persists out to a year. So it's not just the acute diseases or the acute illness from infectious diseases that we need to worry about, it's the consequences of it. If we think about COVID, there's been a lot in the papers recently about long COVID, but really these post-infectious syndromes are not new and they're not COVID specific. We see it with a lot of infectious diseases, which means that the very big savings that Sophia showed in preventing some of these vaccine preventable diseases, if anything, they're likely to be underestimates. We can have the next slide, please. So this is just an example from a review by our late colleague, Janet McElhaney. When you think about influenza, you think about maybe having a fever, some difficulty breathing, a cough, but actually there is a whole sea of what we call downstream effects or downstream complications, which flow from having had influenza. And any doctor who works with older patients is familiar with this. You see a patient who has influenza, they recover apparently from their influenza, then they may develop a complication like pneumonia, which puts them in hospital. They may have a stroke, they may have heart arrhythmia, acute cardiac failure, myocardial infarct, which can also kill them, worst case scenario, or put them in hospital. And in many cases, the loss of condition, which happens when an older patient becomes sick like this, is never recovered. So it's somebody who becomes ill, they lose function, they become housebound, they become dependent. All of that has an impact, obviously, on their quality of life. But when we think about the impact on the broader economy, these are people who are less able to use discretionary spending to contribute to the economy as a whole. So, next slide, please. And this is just a very rough sum up of recent data in this area. If we talk about influenza vaccination, when we look at cardiovascular mortality overall, so not just myocardial infarct, but acute heart failure, acute coronary syndrome, heart arrhythmias, a whole raft of diseases. In individuals who are vaccinated, we're talking now about people over 50 years of age, there's a 56% reduction in their risk. So that is potentially huge, because cardiovascular diseases like this, unlike the flu where you may be sick for a couple of weeks and then kind of off color for a couple of weeks more, at worst case scenario, these are like, or can be, life-changing or occasionally life-ending events, which can persist for months or years after the effect. Alzheimer's, similar story. We're seeing a number of studies, including one done recently in the UK, in Wales, where among older NHS patients, the risk of dementia was greatly reduced in people who were vaccinated. And there have been several very nice, very well-controlled large studies from the US and a couple of earlier studies from Asia, from Taiwan specifically, which showed the same sort of story. And again, dementia is extremely costly to society. It's a dramatic reduction in the quality of life for the infected persons, but it also has a huge flow-on effect into economic activity, not just for the person who's affected, but from family members who may also have to cancel their employment, their holiday plans, their own discretionary spending to care for somebody who's affected. And then ischemic stroke, also greatly reduced by vaccination. So when you put these factors together with the direct causes, the potential savings from getting better coverage are enormous. If we move on to the next slide. And that's just a single vaccine, because I'm showing here data from Zoster vaccination, and you see very, very similar numbers. In the first 3 months after you have an outbreak of Zoster, which by itself can be a very unpleasant illness, but not something which is considered life-threatening, but you see a substantial increase in the risk of heart attacks and strokes, particularly, again, myocardial infarcts and ischemic events of all kinds. And this persists out for more than a year. And if we move on to the next slide, you see a similar picture to the one I showed before. Significant reduction in cardiovascular mortality, big reduction in risk of disease and dementia, and a decrease in the risk of ischemic and hemorrhagic stroke as well. So these are all long-term health conditions which really affect people's quality of life, capacity, spending. It impacts every social and economic aspect. And yet, to prevent this, the vaccinations themselves are relatively cheap. We saw earlier the figure suggesting that in most countries across Europe, spending on vaccination was less than 0.5%, but most of that 0.5% is actually spent on pediatric vaccination. You could quadruple the money you spend on adult vaccination, and it probably wouldn't amount to 0.1% of our healthcare budgets, upfront spending, but the potential savings are huge. We can move on to the next slide, please. So what do we need to do to actually change it? Advocacy, access, activation. People need to actually understand, first and foremost, why this is important for them. Their doctors need to be more proactive in talking to patients about these issues. And governments in particular need to be more proactive in talking to the public about why it's important. We saw with the COVID pandemic how government advocacy can move vaccination to very high levels in high-risk populations. And we saw how the populations in most countries, despite initial vaccine skepticism, accepted vaccination at very high levels because they understood the personal risk to them. So we saw this particularly with older adults. But we haven't really had this discussion around a lot of these other illnesses. And so the consequences are that our vaccine coverage rates in most countries in Europe, or in fact in most developed economies in general, are actually pretty dreadful. So next slide, please. So it needs to be part of a general focus on health. Many countries, including the UK, are increasing slowly the age at which people retire in an attempt to balance the books, if you like, with regard to pensions, with regard to workforce, all the rest of that. But that's only possible if people actually remain in good enough health to be able to work. The same applies to things like travel. People are not going to travel or not going to feel comfortable traveling if their health is poor. It applies to every area of discretionary spending. And vaccination is one part of the toolkit, but other things, healthy diet, getting enough sleep, exercise, no smoking, these are all equally important. And hopefully we should see these things as a whole package, if you like, ensuring better health generally. And I think that's actually my last slide. So I'll wrap up there and say thanks very much for listening.
Fantastic. Thank you very much, Mark, for that really insightful presentation there. I think that quadrupling adult vaccination spend stat is quite alarming, but we can certainly get onto that at the Q&A. So do submit your questions in the box below. So thank you very much. And up next, I'm delighted to welcome Isabel Della Mata, who is a Principal Advisor for Health and Crisis Management at DG Santé within the European Commission. Isabel has been working as a Principal Advisor for Health and Crisis Management since 2008. And before this, she worked as a Counsellor for the Health and Consumers at the Permanent Representation of Spain to the EU, as Deputy Director General of Health Planning of the Spanish Ministry of Health, as an advisor to the Vice Minister of Health, and several other posts at the Ministry of Health in Spain. I'm conscious of time because you do have to leave us very soon. So without further ado, Isabel, I will hand over to you.
Thank you very much. So I will be very short. Even if we continue to say that prevention is better than cure, and vaccination has demonstrated to be one of the best activities in prevention, and the one that is, from any point of view, one of the most effective and efficient. It seems that still we need to justify that vaccination is important, and that vaccination is something that is long life approach and not just for the children. It's not just something to take care about on childhood. The expenditure in prevention, we maintain the same figure, 3% that has been in the health expenditure in general for many, many years. Still today is around 3%. And we can make calculation of what is dedicated to vaccination, but whatever the percentage is, I mean, in any case, is very low compared with what we spend in the treatment of the diseases and the rehabilitation, when, as has been already demonstrated, not only in the slide that we have seen today, but forever, that will be much more efficient if we take some activities, as for example, vaccination, to prevent the disease all around the life of the citizens. So we already, the European Union, during the process for approval, and then with the Council recommendation on strengthening cooperation about on vaccine preventable diseases that was approved in December 2018, we already made clear that one of the factors that is important is the demographic change. And not only because the immunity is waning around the years, but that there has been also a shift in the presentation and the burden of preventable diseases, vaccine preventable diseases, and we need to make the vaccination programs a life approach beyond childhood years. and that the approach, and I am reading, aims to ensure adequate lifelong protection and contributes to healthy living and healthy aging, as well as the sustainability of healthcare system. So we are doing that for the well-being, for the better health of all of us, and also for our healthcare system. So, and how do we get older adult vaccinations? And I think that two things have been already mentioned that are very, very important. One of them is that every contact is an opportunity to vaccination. In the same way that we have done in the past for other diseases, every contact with the health system is an opportunity to check the blood pressure. Every opportunity, every contact with the health system has to be an opportunity to check how the person is vaccinated. And the second one, so to normalize the questions, or to check if the person is vaccinated or not. And the second one has been already mentioned, that is to expand the possibilities of being vaccinated. And that different places and can go from the regular health system to the specific services for vaccination to the workplace, and in the same way that we use sometimes for the children in the schools, that we could use the pharmacies or any other informal health setting, just say like that, where we can have health professionals that could expand that. So, introduce the routine check vaccination and facilitate the access to national or regional vaccination services, and simplifying and broadening the opportunities to offer vaccination. I would like to see one of the two slides that I sent to you, the first one if possible. Yeah. This is just about the COVID-19. I mean, I think that the COVID-19 has helped to make the vaccination in the mind of the elderly. I mean, everybody was very worried, and everybody was very willing to be vaccinated. And it's, I mean, apart from the influenza vaccination, never as now, we have been talking about the need for our elderly to be vaccinated. So we had for the EU-EA population, for the people over 60 years old, at least with one dose, more than 90% of the population vaccinated, and having the booster 82%. So I think that this has been a success. It's not the same for the influenza, it's not the same for other vaccines, but and we need to learn from how we have been doing. I mean, the enormous campaign to have the people vaccinated. We have demonstrated that the vaccines have helped to stop or to control the pandemic, or at least to control the deaths and the hospitalization, and in direct relation with the population that was vaccinated, but also to help everybody. And the second one, please. Second slide, that well, that you can see how the distribution of vaccination has been different over the years. I mean, not only in the younger and below 18 years old, because well, I mean, was not from the beginning that they were recommended to be vaccinated, and the approval of the vaccine was not for all the groups of age from the beginning. But you can see that even in the following year, 50, 59, the uptake of vaccination has been lower than for the elderly, and in the over 60. That is not only the one dose of the full vaccination, being 2 doses when it's necessary, but it's the booster that has more than 80%. So, and then decline. So my main message, and I'm going to finish, is just that we need to normalize the vaccination. We need to make clear that vaccines are not just for children, are for everybody, that vaccines prevent the diseases and to have a good health, and especially controlling what is possible to control, because I'm sure that if now we will have a vaccine for cancer, everybody everybody will be fighting to have that, and we have a vaccine for cancer, by the way, for the HPV, but I mean for others in general. So why not to use something that is in general, that is very efficient, very effective, cheap, and that is accessible to everybody. So we need to continue to make people confident to pass the information. We don't have really many anti-vaxxers. What we have is people that they are not well informed. We need to make the vaccines convenient, and we need to make it easier for the people to access the vaccine. And we need to continue to pass the message, to work with the ones that are that have the scientific advice, mainly the health professionals, and to continue to insist and to continue to make use of this very efficient medicine. Thank you very much.
Well, thank you very much for that really great presentation, offering a health policy perspective there. I think it's absolutely crucial that vaccines become more normalised, and what better time to do that than in the age of COVID-19, especially taking a life course approach. So that's great. And last but by no means least, I would like to welcome our final speaker, Anna Grazia Laura, who is the president of the European Network for Accessible Tourism. So Anna Grazia was first elected as president of ENAT in 2013 and was re-elected again in 2017. She is a graduate of political sciences. She began her career in marketing information at the planning office, at Italia Airlines, and in 1993 she joined COIN, which is an organization involved in creating job opportunities for people with disabilities, where she had the responsibility to develop the group's tourism department at a national and international level. She has been involved in several national and international projects, seminars and network activities, as well as a lecturer in training courses for inclusive tourism and equal opportunities. She is a member of SOAB, which is the Societal Advisory Group of the European Commission's Joint Programme Initiative, More Years, Better Lives. She retired from COIN in June 2017 and is devoted to promoting accessible tourism worldwide through her role as president of ENAT. Anna Grazia, the floor is yours. Sorry, you might still be on mute. I'm not sure.
Yeah, I did it. Okay, thank you very much, Patrick. And I would like, to have the first slide, first of all. Thank you. Well, just a few information on who we are. We are a non-profit association based in Brussels. And we were funded at the end of a European funded project who had the goal to mainstream disability issues in the world of tourism as such. And we are a multi-stakeholders network. It means that we have members from an ONG, and we have members from the tourist sector as well as small enterprises and activities, people working in the tourist sector. We have more than 219 members in 50 countries of the world. So as a matter of fact, our European network is simply linked to the fact that we are financed initially by an European project, but we are now more or less recognized at world level. Next, please. And what is our mission is to make European tourist destination products and services accessible to all travelers and to promote accessible tourism around the world, which is an important issue because many times people with specific access requirements are cut out from the possibility to travel and to enjoy their traveling and their vacation experience. Next, please. Now, tourism. Tourism has been badly hit by COVID, and it's still very hard to foresee a strong recovery this year, maybe on 2023. And these will involve a lot of additional challenges for accessible tourism because the economic crisis due to the pandemic has a lot reduced the available income. and we will also come to seniors that are suffering more than others this situation. We noticed that there are new travel behaviors of tourists with specific access requirements looking for safer and more relaxed destinations, always related to the pandemic consequences. And they are a lot afraid of a tourist access assistance, which is not fully adequate to their requirements and to the risk that they might have when traveling. Next, please. Next slide, please. Okay. We have a few tools that we can count on in order to make things easier for, let's say, the target into brackets that we are looking at. We have guidelines for the tourism sector that were issued by the World Tourism Organization. We have economic support at national and international level from the tourist sector in order to be helped to reopen and to reopen in a safe condition. More or less, every country is releasing the severe restrictions to traveling that they used to have in order to reduce the risk of getting more infected people. And we have vaccines. Next, please. Even if talking about vaccines, we have to confront with oppositions. Do not vaccinate is a let's say an invitation that dates back to the 19th century. And then we have riots from the no-vax people when we have a lot of demonstrations about the possibility to get vaccinated. We have seen a lot of scientific disinformation and fake news that people would believe immediately because they are very eager to believe to what matches with their own convictions. And talking about tourism, we have an unequal distribution of vaccines in the different countries of the world. So we have the risk of having people not vaccinated and possibly infected that come to our countries and put the strong recovery that we hope to have in the future, the strong recovery of tourism at a real risk of being not so strong and not so economical value as we hope. Next, please. As I was mentioning, WTO issued a number of guidelines for tourism operators when there was the possibility, the very feeble possibility to reopen tourism for travelers with disabilities. And they suggested to have travel plannings and protocols to be pay a lot of attention on transport and hotel accommodation, everything that is within the tourist service chain for any traveler, also including tourist activities we go beyond the simple accommodation. Safety had to be guaranteed to everybody, possibly without imposing unnecessary obstacles. But unfortunately, next please, the recovery guide was published on the 3rd of December 2021. I would like to remind you that the 3rd of December is the International Day of People with Disabilities. They also issued a number of guidelines to help tourists with disabilities who might have been blocked during the pandemic in their area of destinations, and they were there without knowing what to do and without having sufficient support to go back home. So repatriate passengers without delay, try to provide courtesy accessible accommodation, engage the destination managers with peer support and adapt sanitary protocols. No one size fits all attitude, because they had to look and definitely into the different requirements and provide precise and adequate answers. But without forgetting to keep the accessibility features all across the value chain, because in crisis time, it's very easy that the tourist sector tend to forget that travelers with disabilities are customers as anybody else. The next, please. And the policies for the launch of tourism, the relaunch of tourism after COVID, is to gather information on accessible tourism and be aware of what it does mean. Adjust accessibility policies and strategies, improve customer service, which is absolutely essential when you have someone who is staying away from home and probably panicking because of the situation. Use international standards and extend professional training in order to be more adapt to answer to any critical question that might arise from the public. Next, please. Now, what are the trends that now are transforming tourism and that are more, let's say, focusing on the post-pandemic situation? Demographic changes, sustainability, new technologies, they all have implication for the tourism sector in general, but for accessible tourism in particular. Next, please. So, changing and emerging markets. As it was already mentioned by Daphne and Sophia, aging population seniors are a very important part of the tourism sector. And why do we include them? Because they do not consider themselves as people with specific access requirement or people with disabilities, but in fact, they have a lot of specific access requirements that have to be met while traveling. And they are still the population with more economic possibilities, but at the time, they are still stuck for fears of pandemic risks. So they don't travel as they used to, and they will need sometimes to readapt to the new situation. Then we have millennials. They are ready to travel, follow health directions. They are digital nomads, but they don't have, for the reason that I mentioned before, they have a diminished purchasing power. So these different trends are not really influencing now the recovery of tourism as we all hope to see in the next few months and years. Next, please. Sustainable tourism was also mentioned, and sustainable tourism is an asset for the tourism industry because it will take into account a lot of different activities in order to reduce the impact of tourism on the world economy in terms of, let's say, increase of pollution, increase of water diminishing, increase of whatever may endanger the tourism as such. And more people are becoming interested in following these rules and try to fit their traveling and their vacation within the framework of a green economy. Next, please. We also have, regarding to tourism, and particularly tourism with disabilities, the strong impact of new technologies on consumption behavior. We have social media, web reputation of the tourist industries, peer-to-peer possibilities to exchange information between the tourists with disabilities traveling, and tourists become testimonials with their judgment on the tourist attractions and services. So they determine the web reputation of destination and companies. And for those who have real difficulties in moving, the virtual and augmented reality may represent a tool for, let's say, for the future, and for including some difficult destination together with those that are much more easy to attend. Next, please. Okay, thank you. Well, the new models of inclusion would include, in our opinion, the regenerative tourism, which means that we shift the focus for a growing number of tourists in order to regain economic value on the tourist sector, to creating thriving destinations and communities, allowing the communities to say which kind of tourists they want. We probably hope not to have Venice conquered by big cruising ships, but to have Venice appreciated by tourists as they can see a city and not simply a tourist market, let's say 2 hours and go. Next, please. Again, for regenerative tourist destination, this kind of concept has the task to bring together tour operators and communities to build together their offer and to create a destination that is able to give more to the other destinations together, guests and welcoming community, in order to be, in a way, a welcoming community which is more inclusive and accessible. And I would like to stop here. Thank you for your attention and open to any question that may arise. Thank you.
Grazia, thank you so much. That was a really insightful presentation. I think you've highlighted that older adults especially face more risks, and that we have a number of tools to try and help people make tourism more accessible, one of those being vaccination. So that brings a close to our presentation. So now I'd like to invite the panelists to join me in a Q&A with our audience. So remember, if you are interested in putting in a question, put one down in the Q&A box below, or get involved on social media using #vaccines-in-vacation and tagging both IRC and CLCI on the screen below, the link on the screen below. So we have a couple of questions. So I'm going to start with Paul Gordon asks, how can vaccination throughout the life course help keep people healthy and economically active? Daphne, I might come to you first, as you are the chair of a life course immunisation charity. But if you'd like to kick things off.
Thank you, Patrick, and thank you, Paul, for that question. One hopes that's self-evident. But of course it's not. And this is the point. We need really for vaccines to become the norm, so that one doesn't just think of vaccinating children, that one thinks about vaccinating adolescents into adulthood, through adulthood, and then into older adults. Because from all we've heard today, clearly it has huge benefits. And it's not just benefits for those organizations that, or for those companies that fly airplanes or for the tourism or hospitality industries. It's for us too. It's for the people. It's for those that can go out and enjoy themselves if they're healthy. And as Anna Grazia has said, if there is proper access for people, and she's absolutely right. As we get older, we don't necessarily think ourselves as being in any way disabled, if I can use that term, but that we do have problems with our legs. We have rheumatism, but that's not a disability, as it were. We don't even think about that, but it does mean that stairs become difficult and all that. So that's one aspect of it. But vaccines throughout the life course help that to keep your immune system good, to stop you from catching these diseases. Travel vaccines particularly, we need to think about, but as has been said, we need to think about flu, HPV, shingles. Oh, there are so many. But the whole idea of vaccination becoming the norm, I think that's the thing. We have to continue to advocate and to communicate, so that there is some understanding across the board as to how keeping your health and encouraging good healthcare and perhaps not just with vaccinations, but with everything. I mean, there are lots of things that Mark said, for example, which I kind of hadn't thought about, but it all comes into the idea that good health should be the norm, and vaccinations are all part of that.
Very much, Daphne. I think that's summarised it very nicely. I don't know, Mark, if you had any further comments on that, perhaps?
Sure. There is a tendency, and I did it myself today, to talk about older adults as though at 65 you get, a gold watch for service and COPD. But obviously that's not the case. The health that somebody has in older age is a result of everything that has happened to them up to that point. So I've pointed out in the talk, for example, how if you get Zoster, which is caused by varicella zoster infection, it greatly increases your risk of stroke. But actually for people under 40 years of age, varicella infection, primary infection or chickenpox, is one of the leading causes of stroke in younger adults. It's present at a much lower incidence. But the kind of damage which is done to your body by infection in earlier life, younger people, and here I'm talking about adults also in their 30s and 40s, have much more resilience. So they can kind of soldier on. But that damage is going to have an effect on their quality of life as their resilience, as their physical reserve diminishes and as they get older. And I'm a perfect example of this. I dislocated my shoulder twice when I was a young man. And at the time, I didn't think about that much. We put it back in, it was sore for a while, it got better. But actually that injury never went away. Now that I'm 60, the injury that I got 40 years ago causes me problems. And it's the same with your immune system, it's the same with your heart, it's the same with your lungs, it's the same with everything. Yeah, so life course vaccination is really important.
Yeah, definitely. I think if you could see something, the damage it has, that you would probably pay more attention to it. And I know Isabel's not on the call anymore, but she made a good point earlier. If you could vaccinate against cancer, everyone would jump on the opportunity. So I think these are kind of important. Excuse the police car siren in the background, very busy here in London. Anna, Grazia or Sophia, did you have any comments on that question as well? How it can keep people economically active?
Well, I must say that what I heard this morning, this afternoon, was extremely enlightening. And I myself have been vaccinated up to the booster dose of COVID. And I'm vaccinated against flu and pneumo something. But what I see is that it's extremely difficult before a certain age to convince people that it's important. Probably it will be, let's say, important to have a kind of campaign made by the public authorities, the health authorities of each country, to show exactly what are the benefits of being vaccinated. Because apart from the fact that you vaccinate young people going to school, and mind you, in Italy, it's compulsory. Otherwise, many people would not do it. And with the COVID, we had a lot of problems to convince people, to force people to get vaccinated. Let's say threatening reduce of salaries or a lot of enormous fees, because there was a strong opposition against vaccine. And COVID was something that struck a lot the people and the population. So after it would grow up so enormously, people were going to be vaccinated, but it's not easy. And I do understand the vaccination throughout the life course is a lot important, but all the population need the support of big promotional campaigns launched by the public bodies or the health authorities, explaining that is good, that is not dangerous, that is not, they will not cause some incredible diseases, because this is what the people think.
Yeah, no, definitely. I think communication is an absolutely fundamental part of ensuring people get vaccinated. So that's key. Sophia, any final thoughts on that question?
Sure. I generally really agree with what's been said. And I just kind of totally agree that, vaccinating people at younger age is really important, because that not only benefits them at that point in time that has benefits later on, but we are seeing those lower vaccination rates among older adults. And I do think, I completely agree with Anna Grazia, that we do need more emphasis there. And we recently did a study looking at how to improve vaccination rates among older adults on social media. And we kind of tested a kind of intergenerational approach there. But what really struck me was how few people were aware at older ages that they're eligible, for instance, for the pneumococcal vaccine. They had so many misperceptions about that vaccine, also for the flu. But I think for pneumococcal and shingles, there's huge misperceptions and lack of awareness. And that anti-vax group, I think, that has been mentioned is actually a really small proportion of those that don't take vaccines. There's so much more we can do. And we found, that campaign that was focused on people living in deprived areas. We know they're traditionally really hard to reach. And there was kind of some stereotypes that kind of helped us think about doing this research, that maybe old adults might not be as engaged on social media. But the whole research completely threw all those misperceptions to the fore. What we saw is that the campaign was cost effective and had a really significant impact on vaccinations. There's so much more we can do. It's just an example that we're not, there's, in terms of the kind of media campaigns, we're not satisfying that to the extent that we can be. And I think, Mark, your point earlier that actually making this a kind of normal, a normal checklist, really, with smoking, drinking, vaccination, we just don't think of it in that way. So there's so much more there. And potentially thinking about that impact on dementia and Alzheimer's and other diseases that people are even more worried about. We know that they're most worried about kind of getting dementia in the UK at least. So there's potentially kind of marketing techniques that can raise awareness to that point. And I think just going back to that link of economic activity is just, making the case really that, investing in vaccine, there's really good evidence that is linked to these economic behaviours, spending work, but also non-market contributions and volunteering. And as mentioned, other diseases that we're not thinking about, people are really worried about. But then if people don't do these activities, that also negatively affects health significantly. Just giving an example, right now, I'm doing some research looking at the consumer-related challenges of people with dementia. And what's striking is since the pandemic, how much people's symptoms have worsened. They were able to do a lot of things before, and now they're saying my symptoms have worsened so much that I can't actually do many of the things. It's just an economic experiment in the impact of staying at home alone. So there's this feedback loop. So it's really, really important, if we're to invest in vaccines, to think about all of these health behaviours, different kind of diseases, essentially.
Yeah, I couldn't agree more. I'd just perhaps like to add a single comment, is that it requires all of the stakeholders to work together for that. The public has to understand why it's important. Governments have to understand why it's important. Individual healthcare professionals like nurses, doctors, pharmacists, they have to understand why it's important as well. So we really have a big educational task in front of us.
Yeah, no, 100%. I couldn't agree more, actually. I'm just conscious of the time. I think we've got about 10 minutes remaining. We've got quite a few questions here. So I've got a couple, I think, relating to technology. So Gary Finnegan asks, the ECDC's COVID-19 dashboard has been a great resource. How difficult would it be to develop another website or dashboard for other vaccines? And then similarly, Emily Soloff puts, could a digital vaccine app help keep people keep up to date with vaccinations, and could this be used like the COVID-19 pass has been done so for travel? So I guess my questions to you are, the first one would be dashboards. Are they useful? Can we use them for other vaccinations? And digital applications, could they be used to help the travel industry and keep people in the loop about their vaccinations they need? Who wants to go first? Anyone?
I can make a quick stab at that.
Go on then, Mark.
So what we saw with the COVID-19 pandemic and the speed with which these dashboards were put into place is that the technology absolutely is there. It's not a question of technology, it's a question of resources. So very recently, just last week, I've been talking to people in a number of national health programs and asking about vaccine coverage. And the commonest answer I got when talking about coverage was, well, we don't know because we don't collect that data. So it comes back to what I said before about every stakeholder needs to be involved. There are no technical reasons this couldn't be done. And personally, I believe it would be useful. But the resources have not been made available to do it because people simply haven't prioritized it until now.
Yeah, so when push comes to shove, we're all kind of deciding to invest in technology. Uh, I guess my follow-up to that would be then, so stuff like a digital COVID pass, could that be replicated for other vaccinations? And how could could it potentially benefit the travel industry? You know, if we kind of feel more comfortable traveling knowing that people are vaccinated against COVID-19, how could this be used potentially for other vaccinations such as flu? Or is that even necessary? Have we lived with the flu long enough not to really necessarily need a digital pass for that? I'm not sure what people think of that, but what role can technology have moving beyond COVID, perhaps? Sophia?
Just had really quickly, I think, I don't know about this, maybe the specific ideas that are really interesting, but I think definitely on the point that, you know, using those kind of technological innovations and new approaches in COVID for other vaccinations is something we absolutely have to do. And what we saw in that study I talked about earlier is that a big barrier, we know this from other studies, is actually just booking a vaccine. So in the UK, you know, booking your flu vaccine, your meningococcal vaccine isn't simple. It's a lot easier to do that for COVID. So I think that's just a simple one that could clearly, looking at the evidence, you know, change a lot of people's minds in terms of just making that, you know, getting that vaccine. But there's all these other areas and suggestions. So I think generally, you know, we've made a lot of kind of good innovations there, you know, making sure we're not losing that.
Brilliant. I do have one question here. Potentially, I think actually, Daphne, maybe this is one for you. We were talking about, I think you mentioned the example of EasyJet earlier, removing the back seats. On I used to work at Airbus, so I know planes very well. On the A319, the small little ones, removing them because then they meet the requirements for staffing due to shortages. But do you think people should be required to have vaccination? The workers in the tourism industry. Do you think that should be the case potentially to help with these staff shortages?
My word, that's a real hot potato question, that one. In general, it should not be necessary to make it mandatory for people to be vaccinated. That's the first thing. Really, it shouldn't. So I go back to my point about vaccination should be the norm. With regard to the vaccination pass, it worked a dream with COVID here in France. Our president said, if you don't have your pass sanitaire, your vaccination certificate, you can't go to the bar or to the restaurant. So that brought in culture. French culture is being able to go to the restaurant, being able to go to a bar, being able to communicate with your fellow citizens is really a big thing. And I'm pretty certain that's true in Italy and Spain and many other places as well. But when the president said you have to have a pass sanitaire to do these things, I think something like 300,000 people signed up for their first vaccination the night that he said it. So there is some measurable value in this, but on the other hand, to have to say to people you must be vaccinated to get onto a plane or a train, and it is true here we still have to show our pass sanitaires to get on the intercity trains, and certainly one had to have them for flying, etc. But to make it all mandatory, I think that would be politically really difficult. I'm inclined to go with the idea of much better communication campaigns. And actually, I would encourage all those people who are within the tourism industry, who are listening to this debate, to this webinar, to make contact with us, if you so wish, or with anyone who is within this kind of, any organisation who is within this kind of industry, within the vaccination, not industry, within the advocacy space, to make contact so that we can see how it can be done, how we can help. Because it seems to me that there are lots of ways that the tourism industry particularly, something very simple, like every time one goes into a travel agent, for example, there's a big notice up saying, "Are you vaccinated?" It's a very simple thing, but it's communication. It's talking to people. It's getting the ideas out there. And that goes across the board, not just tourism, not just restaurants and hospitality, but everywhere, all workplace, anywhere where people are in contact. Definitely.
No, that's really interesting. I think that's a good response. And actually, I think we've got one final question that leads on quite nicely, talking about advocacy. It's from Gary again. One for Anna Grazia. So it's, what role does the European Network for Accessible Tourism see for itself in advocating vaccination? So Anna Grazia, I'm not sure. How do you think you can advocate vaccination?
Well, I think, the role, the topic is extremely important. And in the framework of facilitating traveling for people with disabilities, it will be absolutely important to suggest that everyone traveling, in order to avoid problems at their destination or while traveling, they should have a vaccination. And this is one point. So I think that in all the, let's say, the various social that we have, and the fact that we can have a community on our website, we may tackle this topic. On the other hand, we have to be very careful, because I'm sure that you all know that people with specific access requirement, people with disability, have struggled a lot not to be recognized as people, let's say, ill people. So we would not absolutely think that our advocating vaccination will be seen by people with disabilities as our consideration of them being sick, of their disability being equal to sickness, which is something that they have been struggling a lot since decades, to avoid being considered as such, but just being considered as persons that want to travel. They don't need, for instance, I think that you will know that in many airlines, they ask for a medical certificate when a person with disabilities is traveling. And this is something that people with disability do not accept at all. So trying to promote vaccination as an important means to prevent your own health is good, but not making our, let's say, primary users to feel that we consider them as sick people.
Sorry, I'm still on mute then. 2 years into a pandemic and I can't learn how to unmute my microphone still. No, I was just going to say that's a very interesting point. I did not know that about that barrier for disabled people boarding flights, and I think it's equally as important when focusing on this topic to think about all groups in society to help make tourism more accessible. I think that brings my questions to a close. Thank you to everyone in the comments people on the public who've asked those questions are very, very interesting. So I think that brings the Q&A to a close, and I'd just like to thank everyone on the panel today for speaking and for joining us today. It was a really, really interesting discussion, and I'm really pleased to bring this kind of quite a niche topic together on vaccination plus vacation. So that's really, really interesting. Okay, so just to round things off then, just to keep people in the loop, for all your news on ILC's latest webinars and stay up to date with everything we do here, but you can visit our website on the screen below, and then you can join our mailing list as well and follow us on Facebook, Twitter at ILC UK, and subscribe to our YouTube channel for all our webinars and latest videos. And the same goes for CLCI. Our news and research is available on our website, and you can follow us at our tag on the screen there, which is a bit of a mouthful, but it's C_L_C_I. And yeah, that's great. I think just in terms of our next events at ILC, so we have our annual Future of Aging conference, which we've been hosting for many years now. I can't remember how many, but I will certainly find that out. But this year is a special one because it's our 25th anniversary. So we are going to be looking at a vision for the next 25 years. So all of those who would like to join, there's more information on our website at ilc.org.uk/events, where you can find news about our early bird tickets. And I would highly recommend coming to the conference. I am very biased, obviously, working at ILC, but last year we were joined by a number of fantastic speakers, including ministers from the UK government, as well as people from across the public, private and third sectors. So it's a really, really good opportunity to discuss longevity and the future for the next 25 years. But on that note, I would like to thank everyone for joining us today for the Vaccines and Vacation webinar. And just to say thank you until next time. So stay safe. Thank you very much for joining.
Thank you, everyone.
Thank you.
Bye now.